Snoring. People like to tease about it, but it's a fact of life for more than half of all Americans. Snoring happens for a number of reasons, including nasal passages that are too small. Extreme cases can cause sleep apnea, where you actually stop breathing while you sleep. Doctors at Mayo Clinic say if you have trouble breathing through your nose and it's causing you to snore, they can fix it with a special type of nose job.
As long as I can remember, been a bad snorer.
Brad Hoag used to snore because his nasal passages were unusually small. Even while awake, he could barely breathe through his nose.
When I was young, like a little kid even, my brothers used to make fun of me because my mouth was always open. They called me largemouth bass.
And his small nasal passages.
It affected trying to sing.
But the worst part was the nighttime mouth breathing that caused loud snoring and sleep apnea.
I'd wake up in the morning, my mouth would be so dry from breathing with my mouth all night.
Finally, he came to Mayo Clinic, where Dr. Orrin Friedman performed a special type of nose job to help Brad breathe easier.
We find that a procedure to help improve the nasal breathing during the day and at night will actually help the patient to limit the amount of snoring that they have and possibly even improve their sleep apnea.
Brad had trouble breathing for two reasons. He had a deviated septum, the partition that divided his nose was bent, and his nasal valves caused the sides of his nose to collapse. The surgery, which has a 90% success rate, corrected both problems.
Now I wake up in the morning, my mouth's closed.
For the first time in Brad's life,
and breathe through my nose, and it feels so good, you know.
much less snoring, no more sleep apnea.
I still can't sing any better. So.
Brad says after the surgery, his nose was a little wider, but most people couldn't tell. Dr. Friedman says this surgery is only for people whose snoring and/or sleep apnea is caused by their nose. If your snoring is caused by your throat, you may find relief with less invasive options, such as a CPAP machine, which keeps your throat open at night. For Medical Edge, I'm Vivian Williams.